Scuba diving lets you explore a whole other world underwater, but it comes with risks. One of the biggest dangers is how your body reacts to pressure changes during ascents and descents. We're talking about serious stuff like barotrauma, decompression sickness, and even nitrogen narcosis. These aren't just fancy words, they're real dangers that can ruin your day, or worse. Think about what happens when you dive deep. The weight of the water above you creates pressure. This pressure increases the deeper you go. It's like being in a giant vise that's slowly tightening. Now your body is pretty tough, but it's got its limits. If the pressure changes too quickly, or if you hold your breath while ascending, it can cause all sorts of problems inside. That's where pressure injuries come in. Imagine your lungs, ears, and sinuses like balloons. As the pressure increases, they shrink. As the pressure decreases, they expand. If they can't equalize properly, you get squeezed, and that's when things go south. We're talking pain, discomfort, and even long-term damage. So before you strap on that scuba gear and take the plunge, let's break down these pressure injuries so you know what you're dealing with. Knowing the risks is half the battle, and staying safe is the name of the game. Barotrauma is a big word for what happens when the pressure inside your body cavities gets out of whack with the water pressure surrounding you. It's like a tug of war, and your body's on the losing side. The most common places this happens are your ears and sinuses, but it can also affect your lungs, teeth, and even your gut. Let's start with the ears. You know that feeling you get in an airplane or driving up a mountain. That's your eustachian tube struggling to equalize pressure. Now imagine that same feeling but 10 times worse and you're underwater. That's ear barotrauma. The pressure builds up in your middle ear, causing pain, muffled hearing, and even vertigo. In severe cases, it can even rupture your eardrum. Sinus barotrauma is a similar story. Your sinuses are air-filled cavities in your skull. When the pressure outside is greater than inside, it can cause pain in your forehead, cheeks, and even your teeth. It's like getting a brain freeze. But instead of ice cream, it's seawater. The key to avoiding barotrauma is equalizing the pressure. You can do this by pinching your nose and gently blowing, yawning, or swallowing. Think of it like popping your ears on an airplane, but you're doing it underwater. And remember, never hold your breath while ascending. That's like playing Russian roulette with your lungs. Decompression sickness, also known as the bends, is a serious condition that can happen when you come up from a dive too quickly. Remember how we talked about pressure increasing the deeper you go? Well, that pressure affects the gases in your body, especially nitrogen. When you're underwater, your body absorbs nitrogen from the air you breathe. The deeper you go and the longer you stay down, the more nitrogen your body soaks up. It's like a sponge absorbing water. Now, here's where things get tricky. If you ascend too quickly, that nitrogen doesn't have time to dissolve back into your bloodstream. Instead, it forms bubbles in your tissues and blood. Imagine shaking up a soda bottle and then opening it too fast. The pressure releases and the carbon dioxide forms bubbles that fizz up. That's kind of what happens with nitrogen in your body during decompression sickness. Those bubbles can block blood flow and damage organs, causing a whole host of problems. Symptoms of decompression sickness can range from mild to life-threatening. You might feel itchy skin, joint pain, fatigue, or even paralysis. In severe cases, it can cause seizures, coma, and even death. That's why it's crucial to ascend slowly and make safety stops to allow the nitrogen to off-gas safely.